Muted. All right, Good afternoon, everyone. We're going to start in just a minute or two, so I appreciate your patience, but we'll be starting shortly. Okay, hello everyone and welcome. This is Justin Johnson, the Secretary of Administration. I have with me Andy Polito, the Commissioner of Finance, Brad Ferland, the Deputy Commissioner of Finance, Emily Byrne, the Budget Director, and then Amy and Kelly are both here, they're budget analysts. So what we're going to do today is just give you a quick summary of some of the budget process and an overview of the budget of where it stands. And then we'll be opening up and seeking comments from the public. This webinar or this effort to get public input is something that's required under the statute. It's also a good idea, I might add. We do get good comments and we appreciate the time you've taken to join us. We're doing it a little bit differently this year. In previous years we've used Vermont Interactive Technologies, and that has worked reasonably well, although last year we had very few participants. I think we had fewer than 20 people participate last year. And for this webinar, today's webinars, we have over 100 people participating. So in that sense, this seems to work well, although we will certainly sort of review how this went and happy to take comments on that as well and try to improve it as we go forward in the future. So what I wanted to do real quick was just cover some budget basics. The other thing I should say before we get into that is that the comments, we have a number of people who want to provide comments, and so we're going to allow 3 minutes per person, and then we'll have a little bell type noise just to let you know, and we would then ask you to just wrap up your sentence and we'll move on to the next commenter. You can, as always, send us written comments. We appreciate that, and feel free to add to your comments in writing if you would like. But because of the number of people and the need to get through everyone, we're going to limit people to 3. So let's go to the budget basics. So one thing I'd say about the budget, the budget is a financial plan to achieve your goals. It is not the goal in and of itself. It becomes a pretty important document in state government, but it really is a plan to achieve goals. And so a lot of what we do and a lot of this conversation is around what are those goals? What are the things, what are the priorities, what are the things we want to spend taxpayers' money on? How do we meet those goals? How do we best spend the dollars? The document includes both the revenues and expenditures, and so it really is a balancing act between the amount of money we expect to come in and the amount of money that we would spend. I would say expect to spend, although we're fairly good at spending it. The process for getting the revenue number is what we call a consensus revenue forecast. Vermont's revenue forecast, consensus forecast, is a true consensus forecast in the sense that the administration has an economist that we hire to do work for us, to do calculations. That's Jeff Carr. He's been a long-term multi-administration appointed contractor, very knowledgeable on the state's revenue buckets and for different places where the money comes from. Then Tom Cavett, who is the legislature's hired economist, also provides input. So what they do is they each go away into an independent analysis of Vermont's economy and where we're going and calculate where they think things are. Then they come together and they work with each other to sort of test each other's hypothesis and come up with a single document with a single set of numbers in it. And so for Vermont, consensus doesn't mean dueling sort of numbers. It means really they come together and provide a single document that both the legislature and the administration share. The beauty of this process is we can then spend our time on worrying about what the the best way to allocate the resources, rather than arguing about whether we have this amount of money or that amount of money. And it's worked very well and served the state well, I think. A couple of things I would say about the revenues before we move on is that the revenue is growing. It has been growing year over year fairly consistently since the big global financial crisis, 2008. Obviously, there was contraction at that time, but it is growing, and we'll get into some more details about that growth later in the presentation. Unfortunately, or perhaps not unexpectedly, our expenses are also growing. The other thing I would say, just as a big picture piece, is that both the revenue and the expenses are tending to be more volatile than they used to be. We're seeing bigger swings, particularly in revenues, and revenues that we might have relied on consistently in the past are suddenly not as consistent. And we also see some expenses that bounce around. And I only mention that because it's just a challenge for the budget writers and for the economists and others to work out where we're going to be looking forward when there's volatility in those numbers. Okay, so let's just talk a little bit about the budget itself, or some numbers around the budget. As you can see from the slide that's on the screen, in FY10, our budget was $4.8 billion across all funds, and in FY16, it's $5.6 billion. So you can see that state government is growing. You'll note it's a 2.5 or 2.6% average growth rate. The general fund, which is the state money portion of the budget, the money raised from state taxes and things, has grown 5.2% a year since fiscal year 10. So that's fairly solid growth in general fund. One of the reasons for that, I think, is in the next line, and that is that the federal funds, which make up 35% of the budget, the base federal funds have only grown 0.9% since FY10. And so what we're seeing in part is that the federal government is, the money coming from the federal government is stagnant, and we're using general fund money to backfill some of the needs that we have. And so you put all of that together with some other special funds, and we have a 2.6% average annual growth rate since fiscal year 10. So where does the money come from? Let's go to the next slide. Okay, so, and this slide shows you can see at the bottom the blue bar with a sort of fairly consistent growth. That's the general fund. The little red one above that is the transportation fund. Then you have special funds, are a whole range of different things. They include legal settlements, special payments, and so they make up a relatively small portion of the budget, although growing slightly. Then we have healthcare, which has been a big issue the last couple of years, and buried right above healthcare, I don't think you can even see it, is fish and wildlife. Oh no, sorry, federal funding. Oh no, fish and wildlife funding's in there. Then the federal money, you can see, has been relatively flat the last couple of years, and that is reflected in that very low growth rate. There's a couple of boxes in FY10 and FY11 and bleeding slightly into FY12 that include the federal stimulus money, and that they, as you can see, were significant for a couple of years and have essentially dried up at this point. And that's been one of the challenges, is replacing the stimulus money with other money in the budget. And then finally at the top, well, there's a little bit for retirement funds, and then the green section is the education fund, which is a significant portion of the overall budget as well. So let's move to the next slide. This slide, I'll make sure I get this right, it provides the appropriation by different government functions, and this is all funds. So this is all of the money we get from all different sources broken out by function, and you can see there that healthcare makes up 32, nearly 33% of the budget, education 35, transportation 10, the other portion of human services 5.2, and then it gets much smaller after that. We have some things like debt service at 1.2, relatively small. Higher ed is relatively small. But if we take that and then we compare that to the appropriations from the general fund, so this, what you're looking at right now is all funds. The next slide is the general fund, and it's a little bit different. You'll see there that Medicaid and healthcare and human services, if you take those together, you're looking at 35%, a bit more than 35% of the state budget. Education drops a little bit in this chart, and then you can see that higher education actually comes up a little bit because there's more state funds. A lot of what makes up the payments to higher ed are state funds, and so it increases slightly there. But that just gives you a sense of both from the all funds and then the general fund sense where the money gets spent in the state government. So next up, I just wanted to run through really quickly some milestones, some dates upcoming. The first one, the one that the folks in this room have been focused on a lot recently, is the budget adjustment. So as you probably are aware, each year when the new legislature starts, we have a mid-year adjustment to the current budget, just in case there's been some changes, and just to true up that budget. And so the budget adjustment, it's called the Budget Adjustment Act. That's due to be presented to the legislature December 14th. The aim is to get that going early so that the legislature can work on that and get it out of the way before they get into the fiscal year 17 budget. And then the other thing that's coming up, which is important, it'll happen after we've put the budget together, and that is a revenue update. There'll be an update to the consensus revenue forecast in January. You'll remember last year that there was actually a downgrade in the revenue at that January meeting of the E-Board, and it created a problem because we had a further, we had $18.6 million that was reduced from the revenue, and that meant that the legislature and the administration had to work during the session to actually find that $18.6 million. I don't believe that we're going to get a downgrade this year. There's nothing right now to suggest that. Anything is possible, but right now our revenues are tracking pretty much on target. We're at about, our general fund revenues are running about 5%, just a touch over 5% higher than they were last year, which is a good sign. And we'll see what happens. The economists will do their work, but I think we're in pretty good shape right now. And so hopefully we won't have to deal with a downgrade in January. And then the FY17 budget, the one that we'll be really talking about and taking comments on today, will be presented about mid-January. It's traditionally the government's budget address where the budget proposal is delivered to the legislature and begins the public process of vetting that proposal and discussing it and making changes to it that the legislature does every year. The governor's proposed budget, the work on it began, it's already began, we're working on it now. we have a lot of work yet to do. Most of the people in this room will not be taking much time off between now and the middle of January. Well, maybe now in the middle of April, but or May. But yeah, the work, it's a fairly complicated process to sort of learn what we can from the current year's budget, look at the revenue forecast, talk to the agencies and departments, give them instructions on what we're looking for to try and get to a balanced budget. And so that work is underway and continues. Obviously, the Governor's proposed budget will include some policy priorities, and so those things will be highlighted in the budget. And yeah, we have a few things that we really have to do, like meet our debt service obligations, make the statutory payment to the education fund, those sorts of things. We intend to deliver a budget proposal that's balanced. That is, the expenditures will match the available revenues. You know, it is not a usual thing in Vermont for us to spend more money than we have, and we don't intend to do that this year. I think that obviously that becomes a calculation then between how much revenue you raise and how much you would change that revenue number with with revenue proposals. But whatever we do, the budget that we propose will be balanced. Okay. So I just wanted to give you a little bit of a rundown on some of the challenges we have ahead of us, just so you get a sense of some of the things that we're dealing with. One of them is the reliance on one-time resources, or one-time money. Anyone who's followed the legislative process the last few years will have heard this a lot, this thing about one-time money. We've been pretty high with one-time money in the past, and if you consider the federal stimulus money, it wasn't one-time, but it was maybe two-time money. It was good for a couple of years. We've been up in the $60 million range for money. Last year in the Governor's proposal, we were at $11 million. The final budget that passed the legislature was about $23 million in one-time money. Part of that was because we had to deal with an $18.6 million downgrade. But the challenge with one-time money is once you use it, it is gone, and the expense tends to carry forward. So that means that you have to find the money all over again before you even start the next year. So that's getting one-time money and reducing the reliance on that is important. Retirement obligations are a challenge. Sorry. State employee costs are a big part of state government. The state is basically about people. We hire a lot of people, and their costs tend to be going up faster than our revenue. Human service demands, including, as I've mentioned earlier, Medicaid and DCF in particular. We've seen a rapid increase in Medicaid. It's a double-edged sword. On the one hand, the state has one of the lowest uninsured rates in the country. We have a lot of people on Medicaid. Nearly 1 in 3 Vermonters qualify for Medicaid. What we haven't done is work out a great way to pay for that. We had a proposal last year for a payroll tax. That didn't get through the legislature. But the problem of what to do with Medicaid exists, and it's something we have to deal with as a pressure in 17. We have security issues. After the tragic events of the summer, security's become a topic of conversation and something that we're working on, and so that costs money is an upward pressure. Education financing expectations are always a pressure and will continue to be. Demands for capital funds to replace and rebuild old structures and replace old equipment in state government is a continuing demand, as is technology funding. We still have a lot of legacy technology systems in the state that need to be replaced and upgraded and updated to meet the demands of people today. And so that technology funding will continue to I think, to be a pressure on the budget going forward. And then finally, there's always the need to maintain our both our strategic reserves and our rainy day funds to ensure that if we have another problem, like we did in 2008 or something like that, or we have some kind of blip in our revenues or something, that we're in a position to cover that and not have to immediately flash services to Vermont. So those reserves are important. So they are the generally speaking, the pressures we have on the general fund. And then I just had, before we get to the comment, I have one more slide that I wanted to show. This is the famous alligator mouth, I think they call it over the legislature. Now this is a graph that shows you what's happening with our revenue and our expenses. As you can see from the blue line, the revenue is growing. And it continues to grow fairly steadily on projections right through FY20. You can also see that our expenses are growing. And each year as we are able to align our revenue with our expenses, what happens is the expenses then jump back out because they're growing at a faster rate than our revenue. So that is the challenge we have with the budget there, and something that we'll continue to work on, but I just thought it would be useful to put up so people could see it. And I think that's it for just a discussion of the broad, big picture of the budget. Obviously, we don't have a budget to present at this point. We're still working on that. The governor's proposed budget is a couple months away yet. What we want to do now is hear from you. Hear what your thoughts, your comments on the budget, things that you think we should be thinking about, things that you think we should be either doing more of or doing less of. And so I want to open it up and give you an opportunity to do that. As we have some ground rules which are up on the screen, but I think it's really just a matter of giving everyone a go and giving everyone an opportunity to speak. And I have a list of speakers who've signed up, and we'll just go through them in order, I think. And so the first one is Christy Everett.
Are you on?
Hello.
Hi, Christy.
Hi, how are you?
Good.
Thanks for arranging this opportunity to hear from folks. While it's known that we're going to be facing a budget gap again this year, it's even more imperative that the discussion of any spending for human services gives serious consideration for the need to stabilize the DA system with a committed Medicaid rate increase after stretching the limits of what it can absorb through previous funding levels, years of cuts, and uncovered costs the system has faced. The DA system of care averages a 27% turnover rate in staff routinely. This turnover is a direct result of the disparity in pay that workers in the system face compared to other employees across the state. Differentials that are between $9,000 and $16,000 behind state workers doing equivalent jobs with compensation packages that are far weaker. While the system provides an amazing and comprehensive training ground for clinicians, a huge percentage work for a few years to gain that experience and then leave for higher paying jobs out of the system that we can't possibly match, resulting in having to recruit and train staff all over again from the ground up. The DA system has the proven ability to address a wide range of issues facing Vermont's most vulnerable population, issues including mental health, substance abuse, homelessness, poverty, food insecurity, criminogenic behaviors, and developmental disabilities, among a host of others. The structure of the DA system spreads to every corner of the state and can respond in quick time to the needs of the communities we serve. The system also collaborates with many towns and other agencies to address preventative services, health education, school safety, which are routinely provided without funding, but are in concert with the mission that we all carry out. The work that the DA system does has a direct impact on the social determinants of health and society, enabling people at times to not only survive but thrive, families stabilize, and children succeed. As years continue to pass without addressing the foundational funding needs of the DA system, this will have a direct correlation with reduced service capacity, quality of care, and access to services. When the limits are reached or the system begins breaking down, the state will feel this ripple effect as folks have no other option but to turn to more costly treatment and support options, resulting in increased ER visits, hospital stays, incarcerations, higher crime rates, and other ways. The cost for providing care for one night of inpatient care, if used to support someone in the community, would be the equivalent of a full month's rent, food, and supportive services. Imagine the societal impact that could be achieved if that were able to be accomplished on a larger scale.
Okay, thank you, Christy. I appreciate your comments. And just so everybody knows, we will be, we're going to, we're collecting all of this information. It will be included in our sort of budget process, and we'll be talking about it afterwards. And I would reiterate again, if you have written comments you want to send in, please do that. And then the other thing I would do is ask people, if you are not speaking, to make sure your phone is on mute. I think that will help with the echo problem that we've had a little bit of. Next up, we have Brent Huey, and I believe, Brent, that you are with 2 or 3 people there. Okay, with Brent's not on, maybe we'll go to Joe Allen, and then we can come back to Brent. Joe Allen, are you on?
She needs to enter her PIN code.
Joe Allen, if you could enter your PIN code, that would be great. What is? Okay, Tom Dalton, are you on?
Hello?
Can you hear us?
Yes, is that Tom or is that
Yes,
Joe Allen?
it's Tom. It's Tom.
Okay, Tom, why don't you go ahead and give us your comments?
Okay, I'm here from Howard Center Safe Recovery with my coworker Grace Keller. And Safe Recovery is a program that serves people that are addicted to heroin. And we provide a range of services, including syringe exchange, HIV counseling and testing, Hep C counseling and testing. We link a lot of people to drug treatment, and we do outreach to people in correctional facilities, and we do overdose prevention with naloxone. And Safe Recovery is losing the majority of its funding at the end of the month due to a large cut in funding from the Vermont Department of Health. And this cut represents about 80% of our program budget. And we've already had to reduce our staff from 7 to 2 in anticipation of these cuts. And we continue to get a little over $50,000 in funding from the Vermont Department of Health for syringe exchange, but this amount of money largely only covers the cost of syringes and other supplies. And it doesn't provide enough funding for us to pay for staff and office space. And our program isn't viable or sustainable at the current funding level. And without additional funding, the program is likely to be shut down within the next several months. Our executive director, Bob Bick, has submitted a request to the state for support for Safe Recovery in the amount of $72,000 as part of the mid-year budget adjustment and $140,000 in next year's budget. And that's the request that we're asking you to support. The Governor's Criminal Justice and Substance Abuse Cabinet has recommended that the state find funds to preserve Safe Recovery, and Cabinet Co-Chair T.J. Donovan has said that Safe Recovery is considered a priority program. And my coworker Grace is going to talk to you a little bit about why we're considered a priority program. In other words, what would be lost if Safe Recovery doesn't get funding to be able to continue our services.
Hi, yes. We are the pilot program for naloxone in Chittenden County, and it's a statewide pilot. And to date, we've handed out 5,000 doses of naloxone. Naloxone is a nasal spray that reverses the effects of opiate overdose and gets the person breathing again in 2 to 3 minutes. So we've handed out 5,000 doses of it out of our office alone, and 432 documented overdose reversals from kits distributed by Safe Recovery. We've had 7 lives out of those saved at our office alone. So these are people who've reported that they've used it to save somebody else's life and come back and told us about it. And that number is 432. 55 of those were in August 2015. So that's a high number of people having overdoses that were saved in August. We've had over 2,000 individual face-to-face overdose prevention training sessions. We have over 3,500 syringe exchange members with about 40 new members enrolling each month. We have over 12,000 direct member visits per year. We have over 4,000 drug treatment options counseling and referrals per year. We also have 350 free and anonymous HIV and hepatitis C tests performed per year. Some of those were done in the correctional facility. We have over 200,000 used syringes that are returned and safely disposed of to Safe Recovery each year. And we've retrieved and safely disposed of 107 found in the community in 2014, of which 50 were referrals from Burlington Police Department, and which saved officer time. We've completed over 250 Chittenden Clinic referrals, that's methadone clinic referrals, via outreach to the correctional facility. We've had 164 clients provided with specialized case management. We link many people to health insurance and other public benefits, mental health treatment, crisis services, employment services, and housing. And over 85% of our clients report a history of homelessness. So we're working with high level of poverty and other challenges other than just drug use and treatment. We provide bus and transportation to out-of-town residential treatments. We provided over 1,400 bus passes this year to facilitate transportation to local appointments. And then in the last year, we've had a lot of access to interesting and challenging situations and clients. We linked an African-American male with untreated HIV to HIV treatment, resulting in successful suppression of his HIV viral load. We linked a veteran to medication-assisted treatment after she reversed an overdose. We assisted women who was 20 years in a 20-year abusive relationship to get her own safe and stable housing. We supported new parents in accessing treatment and helped them secure an apartment and regain custody of their child. We trained a mother and father on naloxone who recently experienced an overdose with their son. We helped an inmate in his 20s access cancer treatment. So we have a lot more of these of clients specifically, but it shows that we are really on the front line of opiate addiction and treatment, and there's a lot that would be lost without our program here.
Okay, thank you so much to both of you for your comment. I appreciate it. I have heard about the issues of the Safe Recovery grant from the Department of Health, so we'll certainly include that in our conversations here. And I think TJ and others have raised that issue as well. So thank you. I wanted to go back. Jo Ellen, are you on?
Yes, I am. Can you hear me now?
Yes, I can hear you now. So Jo Ellen, why don't you give us your comments now?
Thank you very much. My name is Dr. Jo Ellen Tarallo-Falk. I'm director of the Vermont Suicide Prevention Center, a program of the Center for Health and Learning. I'm speaking on behalf of 40 member agencies, organizations, and individuals who believe the state should be doing more to prevent suicide in Vermont. Currently, the only direct allocation for suicide prevention in the state budget is $100,000 to the Vermont Suicide Prevention Center through the Vermont Department of Mental Health. We are requesting a doubling of that allocation from $100,000 to $200,000, an extremely modest increase in light of the healthcare and human services costs and expenses that will be saved. Please consider this request to support suicide prevention in light of these facts. In Vermont, more people die by suicide than from motor vehicle accidents, homicide, and drowning combined. Suicide is the second leading cause of death for Vermonters aged 15 through 34 and the third leading cause of death for Vermonters aged 35 to 44. The problem of suicide has grown 40% over the past 8 years. Vermont's suicide death rate per 100,000 people increased from 12 to 17 per 100,000. Over the past 10 years, Vermont's suicide death rates have averaged 30% higher than the U.S. rates. The Centers for Disease Control estimates there are 32 suicide attempts for every suicide death. In Vermont, this would translate to over 3,000 very costly suicide attempts being made in 1 year. The idea that if someone wants to kill themselves, they'll find a way is a myth. Studies that follow people who made serious suicide attempts find that more than 90% of them do not go on to die by suicide. Suicide is diagnosable, it is treatable, and can largely be prevented. The Vermont Suicide Prevention Center promotes effective evidence and results-based approaches to health promotion, prevention, intervention, treatment, recovery, and follow-up to ensure that we can avert crisis. This work has a great impact on decreasing the cost of spiraling mental health crisis in healthcare delivery and in saving immeasurable pain and suffering due to loss. The following is a quote from Dr. Jay Batra, Vermont Department of Mental Health Medical Director, about the work of the Vermont Suicide Prevention Center. The Vermont Suicide Prevention Center is leading the way in coordinating efforts, educating the public, caregivers, and gatekeepers. They are raising awareness about one of the most pressing public health crises in Vermont. Their work is literally saving lives. We work cross-agency, we work interdisciplinary, we work with community providers. Thank you for seriously considering this request.
Jo Ellen, thank you very much for your comments. I appreciate them. Next up, we have Lauren Mull. Sorry. Oh, Brent Huey. Brent, are you on?
Great, thank you very much.
Okay, thank you. We can hear you, so go ahead with your comment.
Hi, I'm Beverly Williams. I'm from Burlington, Vermont, and I receive services from Champlain Community Services. I'm the president of Champlain Voices. We are part of Green Mountain Self-Advocates. This year, one of our group goals was to understand how the Vermont state budget affects those of us who develop mental services. Sorry. I'm pleased to be a part of the discussion today. Let me tell you a little about myself. I currently live with my uncle, but soon to be moving into a shared living provider. I work at the Visiting Nurse Association Adult Day Program. I've been there for almost 5 years. I have support staff that assist me with getting there. I need to go for advocacy meetings and meetings with my service coordinator. Having support staff gives me many independence, which for me means getting out into the world, making a difference by sharing my skills with others. I have a question for you. I've heard the governor said that many programs will get the same amount of money this year that we got last year. This is a problem for programs like developmental services, because each year more people need services. Are you planning to cut services for people already in the system so there is money for the new people coming in? Thank you for listening.
Hi, my name is Nicole Dolmer. I am from Champlain Voices Self-Advocacy. I get services from Howard Center. I am a self-advocate who has worked a lot with Green Mountain Self-Advocacy Organization. I work at Pillsbury Manor doing housekeeping. I also work in professional self-advocacy work. One committee I do is through Center of Disability and Inclusion. I am on the CC committee. I am also on the Jean Garvin committee, doing applications for students or the public for working in the field of people with disabilities. I am involved with Partners in Adventure, which is an organization where I work making and selling granola. Right now, I am a volunteer for the VSA Bridging Program. I am mentoring a high school student in this program through VSA Art. I am very involved with Special Olympics, on the board, athlete and global messenger, leadership program. I also do an organization called Best Buddies with St. Mike students. I like being with my friends, listening to music, watching movies, playing games, and advocating for myself and others with disabilities. My support workers, class subs, case manager, and home provider at my agency help me with my work, employment, current jobs, train on job sites, in the community. They take me to appointments, work on ISA goals like cooking. They take me to meetings, work with technology as in my laptop, photos, and music. They help me with the basic living and life skills, such as grocery shop, errands, and social and work activities. Listen, support, advocate, caring, and help me be more independent in the community. A big part of my supports are working on scheduling during the week with my supports in place for the week. They help me with relationships, socially understanding community outreach with friends, family, and work, as well as health and safety. My worker helps me navigate directions and also my case manager for safety, primarily transportation. I cannot drive because of my learning challenges. Also, she helps me to do my money at my local bank so that I can work on my financial status. My case manager assists me with all of the above as well. Now I have a couple of questions for you. More than 75% of the people who are eligible for developmental services do not get any. Can you explain how you figure out the need for developmental services is being met? And what kind of information do you need from us, the people, about the needs for services and programs in our community? How are you measuring needs if you are not involving us? Thank you for listening to me today.
Hi, I'm Thomas Kaus, and I'm from Essex Junction, originally from Jericho. I received services from the Howard Center. I'm currently an extended year student at Mount Master Union High School. Part of my day involves the bridging program that is run here at Champlain Community Services. The bridging program gives us students above 12th grade an opportunity to get off school grounds and into the community in a meaningful way. The program focuses on 4 learning areas: independent living, community connections, career exploration, and advocacy. Speaking of advocacy, I'm also part of Green Mountain Self-Advocacy. Our bridging program has an advocacy group, which I am the president of, which is called Bridging Advocates Together. I am also a member of Champlain Voices and have been attending meetings for a group in Montpelier called Capital Advocates Together. Being in multiple advocacy groups has given me the opportunity to explore my options for when I graduate. I know the skills I'm learning in them and will assist me in achieving my goals that I have in my life, such as speaking enough about things that will affect the future. So I have a question for you about the budget. We have had cuts to developmental services 6 times in the last 9 years. This means every time there is a budget shortfall, the people who receive services have to sacrifice. Do you think it is okay to cut services from the most vulnerable Vermonters? And please keep this in mind as you make decisions that will affect my future. Thank you for listening.
Thank you very much. Those were our three speakers.
Okay, thank you. This webinar and meeting is really to get comments, but I just would make one sort of response, and that is, well, first of all, I want to say that we heard what you said. We appreciate you taking the time, all of you, for explaining the way those services impact you. It's good to know. And I would just say that we, certainly in the Secretary of Administration's office and the Budget Office, we don't, as a general rule, make, or rarely ever, if ever, make sort of programmatic decisions. We work with the agencies and departments where those programs are housed to talk to them about how best to deliver services. But we do appreciate your comments, and they will be taken into account. So thank you for your time today. Next up is Lauren Mulhern. Lauren, are you on?
Yes, I am.
Okay, Lauren, you can give us your comment. Thank you.
Thank you so much. I am a parent of 3 children, and I live in Bennington, and I would like to thank you all for allowing me to speak today. For many years, I have been working with families in advocacy to access appropriate mental and behavioral health services for children, adolescents, and adults with disabilities within their home, community, and educational settings. Unfortunately, I have witnessed firsthand the negative impact insufficient funding in these areas had on children and adolescents diagnosed with those developmental disabilities that prevent them from participating in everyday life activities. Families have often been impacted financially and experience loss of income when the parents of those children with disabilities take time off of work to manage the mental and behavioral health needs when they are unsuccessful in either the school or community setting. The lack of child psychiatrists, psychologists, and providers of ABA services within the state of Vermont, the lack of funding for hospital diversion programs, and insufficient reimbursement rates for services not only restricts the scope of care and treatment received, but continues to delay and sometimes prevents delivery of those treatments. Children and adolescents not receiving community-based services in support of those needs have often required the assistance from the Department of Children and Families, or they have required residential placements because the needs can't be met in the community or through the state of Vermont in general due to a lack of providers. I really wish to ask that everyone continue to support and increase funding for community-based services and improve the reimbursement rates, and also provide funding for any kind of behavioral health services, allowing individuals with disabilities or with mental health diagnoses to be successful in receiving an education, but also to support their independence, be able to have employment, be successful in interpersonal relationships, and live a valued life. And I thank you for your time.
Thank you so much. Appreciate you taking the time to give us your comments. Is Beth Stern on? Beth, can you hear me?
Yes, can you hear me?
Yes, I can. So go ahead with your comment. Thank you.
Great, thank you. My name is Beth Stern. I'm the Executive Director of Central Vermont Council on Aging. I am also the President of the Vermont Association of Area Agencies on Aging, which represents the 5 area agencies which serve seniors in the whole state of Vermont. Vermont's 5 area agencies on aging serve more than 30,000 seniors annually. We work with community partners to distribute over 1 million meals per year, providing critical nutrition and social connection for older Vermonters. We provide case management to over 7,000 seniors. We provide one-on-one Medicare Part D counseling and enrollment assistance. We operate a statewide senior helpline which answers thousands of calls each year. We support caregivers, run exercise and wellness classes, and we contract with public transit agencies, mental health agencies, Vermont Legal Aid, and other community organizations to help seniors stay independent. We do all of this on a collective budget of less than $16 million a year. About half of that comes from the federal government. Older Americans Act funding has remained stagnant or decreased for the past 8 years. We have been able to fill some of the gaps with foundation grants and private donations, but the need is growing. We are all seeing increased demands for meals, and in some areas, senior centers are having to start waiting lists or decrease the number of meals they are serving. Vermont is the 2nd oldest state in the country. 25 people turn 65 each day in Vermont. We must, as a state, come to terms with this and adequately fund the services that support these seniors. Vermont has a focus on keeping people at home rather than in nursing homes. Yet while the state of Vermont gives nursing homes an automatic cost of living increase each year, home and community-based services get no increase. We feel that this is unfair and unrealistic to expect our services to stay strong without a commitment to fund them adequately. Our agencies are under the same pressure as nursing homes. We have staff, we have health insurance, we pay providers to produce services. Yet with no increases, we are having to cut back just when the population of seniors is exploding and the demand is increasing. We would like the state to agree to parity in funding. Home and community-based services should get the same cost of living increase as nursing homes. We also feel that the state needs to support nutrition for seniors. It is well known that malnutrition is one of the most common causes of hospital admissions for seniors, yet the state currently adds no funding to senior nutrition. The demand for meals is increasing rapidly, and without more funding, some seniors may go without a needed meal. And finally, we are concerned that healthcare reform efforts currently do not include home and community-based providers. While this isn't a direct budget ask, it is important to acknowledge that without our input and involvement, there will be a huge gap in the ability to keep seniors out of hospitals and other expensive settings. Thank you very much.
Thank you for your comments. I appreciate you taking the time. So I think next up we have some folks from the Howard Center, although I'm being told that you have to unmute your phone. So are the Howard Center folks on? Greg Masterson, are you on? Greg, can you unmute your phone? Margaret, are you on? Margaret, can you hear me?
Yes, I can.
Okay, Margaret, we're going to let you go next. So whenever you're ready, thank you.
Okay, thank you very much. My name is Margaret Joyle, and I am chair of the Adult Outpatient Programs of the Vermont Council of Developmental and Mental Health Services. And I want to speak for just a few minutes today about who Adult Outpatient is and what the funding impacts are for us. Adult Outpatient Programs provide services to, last year, 8,217 clients. We provided 64,000 services to them. 34% of those clients had incomes of less than $10,000. So we see people who struggle, with homelessness, with illness, with issues associated with the stressors of low socioeconomic status, which causes a tremendous amount of strain and attendant psychological and physical issues. 12% of the adult outpatient population last year was uninsured. I mention this because in healthcare reform, we seem to have an idea that everybody's insured. At Washington County Mental Health, in our adult outpatient program, we absorb 80% of our self-pay costs. What that means is we billed out a certain amount, we collected a tiny amount of it, we wrote off the rest. So that constitutes an ongoing and significant economic strain for the adult outpatient programs across the state. We get a small amount of money to help defray those costs, but it in no way covers the deficit. In addition, most of our clients are Medicaid, and so we don't have the opportunity to do cost shift to private insurance, as we have very little private insurance, relatively speaking. This year we are under considerable strain as the Department of Vermont Health Access has already cut our group therapy rates from $60 per hour-and-a-half session to $40 per episode, regardless of length of session. As of January 1, they will cut those rates again, and we will receive between $15 and $20 per group therapy session, regardless of the length of session. I mention length of session because for groups in substance abuse, trauma treatment, an hour-and-a-half is the standard of practice. It would be unethical for us to provide a shorter group, and yet that can't be taken into consideration. This rate is lower than any rate that I receive anyway from any other payer, and will have a huge impact on the system. 4 agencies have weighed in, and our estimated loss, just 4 out of 16, is $229,815 for next year. When people think about adult outpatients, they often think that the clients who come to the designated agency systems are really just as well served in the private sector. We saw last year 14% of our designated agency clients in the mental health services, not in substance abuse, had substance abuse diagnoses. 4% had organic brain syndrome or traumatic brain injuries. 5% had schizophrenia or another psychotic disorder.
Okay. So, Margaret, the time is up. I do appreciate your comments. And I think we've been furiously taking notes here. So we will absolutely be having conversation with our colleagues at AHS about this going forward as part of the budget. So thank you. I appreciate the time you took. I think we now have the Howard Center folks are now on the phone. Can you hear me?
Yes.
Okay, go ahead. I think you have 4 people?
Right.
3 people. Okay, go ahead.
There's 4 of us.
Okay, 4. Go ahead.
Okay.
Hi, my name is Kate Lopez. I've been a clinician case manager for Howard Center for 19 years. I've seen quite a bit. There are many in need who have been helped and many more out there. I recently had a client in need of hospitalization. He was very sick, off his meds, disorganized, psychotic, etc. There were no beds. He wound up in our diversion program for 3 weeks. The usual stay is less than 1. The suffering man's mother was very upset. She wanted to know why her son was not going to be hospitalized. Her words were, "Are we in a third world country?" Sadly, that is pretty true in the case of mentally ill people. The system is broken. We need help in the form of funding, advocacy, and education. Everyone has an aunt, a brother, a cousin, a friend's sister who suffers from mental illness. It does not discriminate, no matter what. We need help in order to help those in need. Our salaries need to be competitive. I should be making 2 to 3 times more than what I'm making, given the number of years I've put in. I've seen 60 to 90 talented clinicians quit. That means each time a close relationship ends, someone who is trusted is gone. That person's world is in upheaval again, and the staff feel the loss too. Please help us keep fighting the good fight. We want a healthy, safe outcome for all. We cannot do it alone. Do not just give lip service when it serves your purpose. Thank you.
Hello. My name is Kate Kappelman-Sins, and I'm a supervisor in the School Services Program at Howard Center. We serve around 900 clients in schools throughout Chittenden County with comprehensive case management and counseling. Part of our clinician's role is to make referrals to appropriate mental health services, including individual and group therapy. I was highly dismayed to learn that the reimbursement rates for group therapy will decrease significantly in January, which will necessitate the reduction and/or elimination of therapeutic groups in our communities. I am concerned that the state legislature does not recognize the unique benefits of group therapy to youth and the loss of skill-building opportunities that will occur due to this budget reduction. Group therapy allows for mental health services to reach a larger number of children and youth in one setting and is often the most appropriate method of service delivery for this age range. Youth are able to develop and practice social skills and coping strategies with the supervision of skilled mental health professionals. They are able to hold each other accountable for skill development in a manner that could not be accomplished in a one-to-one relationship with an adult. Therapeutic groups such as the 16-week Sexual Trauma and Recovery Group allow for longer-term treatment of trauma symptoms that can support prevention of unhealthy sexual behaviors in a child's future. The groups offer a simultaneous parent group to reinforce skill development. The elimination or reduction of these groups will impact our communities significantly, as children will not have the opportunity to participate in best practice treatment modalities, thus increasing the risk for sexually harmful behaviors and expression of trauma symptoms at home, school, and in the community. Please reconsider the reduction in Medicaid reimbursement rates for group therapy in an effort to maintain the strength of community mental health in Vermont. Thank you.
Hello, my name is Catherine Isham. I'm an administrative assistant here at the Howard Center Outpatient Division. We've recently been subject to a battery of cuts to our services. Some of the impacts of these cuts are, I'm sure, more obvious than others, and have been or will be discussed by my fellow Howard Center employees. But I would also like to add another element to the more obvious truth. Our state is currently undergoing a narcotics crisis. During such a crisis, it makes obvious sense to beef up spending on treatment for those with addictions and enforcement where it concerns rooting out the sources of drugs. But by cutting funds to human services programs, particularly for children, we are doing a huge disservice to preventative measures against substance abuse. In the famous Rat Park experiment, narcotic drugs were provided to two sets of rodents, those who were in caged isolation and those who had a healthy, pro-social environment typical of their species. Rats in the idyllic Rat Park were 19 times less likely to become addicted to narcotics than those in caged isolation. It's a potent warning that the best cure for addiction is to prevent the citizens of our state from finding themselves in vulnerable social and emotional circumstances that lead them to turn to the numbing power of addictive substances. Human services programs are dedicated to providing people with these social and emotional supports, the kind of supports that can help prevent or turn away people from finding their solace through substance abuse, including narcotics such as heroin. Thank you very much. That's all from the Howard Center. Thank you very much.
Thank you so much to all of you for your comments. We do appreciate them. Next, I think we have Greg Masterson. Greg, can you hear me?
Yes, I'm here. Can you hear me?
Yes, I can. Yes. So, Greg, go ahead.
Hello, my name is Greg Masterson. I'm the Assistant Director at Families First in Southern Vermont. Families First is a developmental services agency. I'd like to address the issue presented by family-directed services such as community supports and a Medicaid waiver. I'm specifically referring to services that are directed by a home provider or a family member for a person with a Medicaid waiver with developmental disabilities. These services are cost-effective to the state, but don't necessarily help to address the needs of an individual. This employment strategy does not provide any benefits to the employee. As this practice becomes more and more common, more people are ineligible to receive paid time off and disallows for staff to afford to get any kind of break from their job. Families First regularly has people who are employed in this way who are forced to work over holidays in order to make ends meet and cannot afford to take a vacation. This creates a climate where we are directly involved in creating a class of individuals who work as many hours as possible, no chance of overtime pay, and potentially no option for affording to take any time off. This leads to staff burnout and helps create turnover, as we, as an agency, cannot offer incentive to maintain staff. Additionally, the quote, cream of the crop, unquote, of staff does not want to work these self-directed hours despite a relationship they may have with an individual. They want to work for the agency where they can receive agency benefits. And more challenging client staffing requires oversight from agency staff, which is not reimbursable under this arrangement. If we want to provide oversight and supervision, we are doing so at our own cost. It seems that this arrangement is not really a choice and, in fact, is being forced upon families without choice. Even when the families request agency-directed services, it does not mean they will receive them. A group of state bureaucrats makes that decision for them, regardless of a family's opinion. And obviously, the family wishes are neither heard nor met. It's time to readdress this process, and despite the fact that this saves the state money, realize and address the issues created by this funding method. What will be the long-term effects for people with developmental disabilities who cannot maintain quality staff, while an economic class of individuals who cannot get a raise, receive mileage reimbursement, or afford to take a single holiday is growing and becoming more predominant? I ask you to think how this group is beneficial to Vermont's long-term economy, and if this were you, would you stay in Vermont? Thank you.
Thanks for your comments, Greg. Next up, we have Chuck Myers. Chuck, go ahead.
Thank you. My name is Dr. Chuck Myers, and I'm the Executive Director of NFI Vermont, stands for Northeastern Family Institute. As part of the designated and specialized service agency system of Vermont, NFI Vermont embraces the priorities described by the Vermont Council of Mental Health and Developmental Disability Services, also known as the Vermont Care Partners. In addition, our experience at NFI tells us the economic plight of many Vermonters is very bad. In fact, it is even now worse than in recent past, primarily because, as we are hearing in the presidential contest, the economic deck is stacked against the poor and middle class in the United States and, unfortunately, even in Vermont. And they were more negatively affected than wealthier families by the 2008 crash and have not recovered. The administration and legislature of Vermont has historically gratefully supported those who are most vulnerable. Thank you for that. Thank you for the decisions that led to that support. It's important that you know that your support is now necessary than ever before. And in fact, that your support needs to actually increase, even though these are difficult budget times. Please remember that Vermonters are worse off than ever. Cost of basic items like housing and food have skyrocketed due to many factors, including the crash of 2008. Under-resourced families are overrepresented in the population that's served by the mental health system in Vermont and needs your support. I'm asking the legislature to look into increased state revenue, increase funding to the public mental health system. As you heard earlier, our mental health system and developmental disability service system experiences between 25 and 30% turnover rate, largely because positions are underfunded. Our salaries are between $12,000 and $16,000 a year lower than people providing similar services with different funding sources like schools, hospitals, and physicians' offices. We need to increase the funding in part for greater options, additional options for hospital diversion services, teens and youth. It's also important to understand that complex trauma, which is experienced by children, is the most important issue for our healthcare system to prevent and intervene with early. Prevention and early intervention will not only decrease the pain and suffering of victims. In addition, there'll be a decrease in healthcare costs and decrease chronic health concerns. This is demonstrated very dramatically by the results of the ACEs study, which has identified that childhood trauma leads to chronic health disorders later in life. Ensuring the emotional and physical safety of all children will provide a profound contribution to the field of population health. It'll be the greatest significant contribution to the field of population health since inception. 40% of healthcare services. Thank you for your time. Thank you for the opportunity to contribute to this discussion. Thank you.
Thank you. Thank you, Chuck. We really appreciate your comments, and we will take them on board. The next speaker, and sorry I just sort of keep moving through the speakers. It feels a little bit weird, but I just want to make sure we get to everybody. So the next speaker is Karen Topper. Are you on?
Yes, I am.
Okay, we can hear you, so go ahead.
I actually am going to share my time with the person who receives. But before I do that, I do want to say that it feels a little bit like the whole truth when you say that the programmatic decisions are left to the department, when the reality is that Commissioner, yourself and the governor are giving instructions that people need to level fund programs. And so what I mean by that is that if there are programs that have increased need every year, then it really is not just a programmatic decision. You actually are kind of instructing, I feel you're instructing people to make cuts, because it's they don't really have any other choice than to cut their services when they have increasing need. So now I'm going to share my time. I'm going to turn it over to Nicole LeBlanc.
Hello, my name is Nicole LeBlanc. I'm the Advocacy Director for Green Mountain Self Advocates. I manage my own services. Each year, 200 new people come into the system because of some sort of crisis in their life, like homeless, aging parents, transition-age youth who need support to keep their jobs. I'm concerned about the level of funding of the state budget, because every year in developmental services, new people come in, and when that happens, existing people need to take a cut in order to pay for the new people. There have been cuts 6 times since 2006. Every time there's a budget shortfall, people getting services have to make a sacrifice. Why do you assume that it is okay to cut services from the most vulnerable Vermonters? Another challenge for people who rely on services is that our staff don't make a livable wage. We need annual cost of living increases because many of the agencies and many people are struggling with staff turnover and staff retention. A budget is a document of values. As a society, we will be judged by how we treat the most vulnerable among us. Please adopt a budget that puts people first and is based on need instead of manage the money. Thank you for listening.
Thank you. We appreciate your comments. Sorry. Okay, so who's Jenna Trombley? Jenna, can you hear me?
I can. Can you hear me?
Yes, I can. So go ahead with your comments.
Thank you. My name is Jenna Trombley. I'm the Director of Human Resources at the Clara Martin Center. I'd like to speak on the Designated and Special Services Agency system in Vermont, which serves individuals with mental illnesses, substance abuse issues, and/or developmental disabilities, most of whom are lower-income Vermonters. Roughly 85% of the funding for the DA and SSA system comes from Medicaid reimbursement and grants. The Vermont State Legislature controls the increases in this funding, and our ability to provide cost increases to our staff relies on these rates being adjusted annually by the legislature. Over the past 5 years, the gap between the DA and SSA funding and the increases in the Consumer Price Index has widened to 15%. These disparities negatively impact the stability and effectiveness of the workforce within the DA and SSA system, which has a direct and significant adverse effect on the quality of life and treatment outcomes for the people that we serve. As a Human Resources Director for the DA and SSA system in Vermont, I see the long-standing lack of regular cost of living increases funding as reaching a crisis point. Our current ability to recruit and retain a workforce that is adequately credentialed, trained, and skilled to treat and support the current and future needs of Vermonters with mental health, developmental disabilities, and substance abuse issues is extremely difficult. Increasingly, we are seeing our staff leave this system for higher-paying jobs with better benefits within the public education system, for human services jobs tied to the hospital system through the Blueprint, and for positions working for the state of Vermont. The statewide average turnover for the past 3 years for this entire system has been 27.5% annually. The increasing loss of our workforce is expensive, disruptive, and detrimental to the system's capacity to deliver quality services to the people we are contracted by the state to serve. The chronic and long-standing underfunding of the DA and SSA system has no longer allowed us to attract and retain a stable workforce. We need a regular cost of living increase that is predictable and adequate to allow us to retain a skilled workforce. The practice of annual cost of living increases given to hospital staff, school personnel, and state of Vermont employees, while not granting the DA and SSA workforce the same standard, has brought our workforce to a point of crisis that needs immediate attention. We ask the legislature to support the ongoing cost increases to this system, the same as it is done with physical health care in hospitals. Without this, we fully expect an ongoing erosion of our workforce, and over time, the consequence will be increased incarceration rates, increased substance abuse and addiction, and a rise in referrals for hospitalizations. In 2004, the Pacific Health Policy Group was retained by the state of Vermont to do an evaluation of the designated agency and special service agency system. They recommended that the state, and I quote, tie administrative allocations for wage increases to the cost of living and step increases provided for state employees on an annual basis. Under this option, AHS would provide an adjustment to the DA and SSA budgets for wage increases in an amount that could, over time, permit the equalization of wages within that system to those of other public employees. At a minimum, such an adjustment should allow these agencies to move their wage levels to something that more closely mirrors the public sector of wages in Vermont. While the designated agencies function as a type of quasi-governmental system, wage equity is an important issue for maintaining a stable and experienced workforce within the system, end quote. In summary, I urge you to support the Vermont Care Partners request for a 3% Medicaid rate increase for FY17 and for each of the next 4 years to achieve a viable and sustainable system of care that over time, given our current level of underfunding and workforce challenges. Thank you.
Thank you, Jenna. We appreciate the comments. Thank you. Next up, I think we're going to do Penny Pizer. Penny, are you on? Okay, we can hear you, so go ahead with your comment.
Okay, can you hear me?
Yes.
Yes?
Yes, we can.
Okay, great. Hi, I'm speaking on behalf of a parent and one who has received tremendous services from Northern Family Institute. If it wasn't for Northern Family Institute and what they did for our family, we would have been another one of those cases lost. And what we're trying to do is do support and say that the home, their group home situations that they have are fabulous. Allenbrook was one. Their family counselors were tremendous. That every single person in community-based services that we've worked with, not only have they helped our family, but we have become a unit, so much so that we've been certified with DCF to help transgender youth, the first home. And so if you help these services to survive and do what they need to do, the individuals who benefit can also reach out and help others. And hearing everybody's case today, it sounds very sad and disheartening that no one is being served to the best of their ability in a field that is extremely difficult. So as a parent and having been receiving services for our youth, I want to say thank you and that we please keep supporting and increasing the funding. Thank you.
Thank you so much, Penny. We appreciate you taking the time to make the comment. David, we're having some problems unmuting you, but can you just say something to see if I can hear you?
He's off.
Yeah. Okay, we are having a little challenge just with David and Scott. We can't unmute you for some reason. We do have some more time though. That would bring it, and what we would ask you to do is send us comments in writing. We would be happy to receive those. They will be taken into account along with every other comment. I also, given we have a little bit more time, wanted to see if anybody else wanted to speak. If you're in the webinar and you can click the button to raise your hand if you want to speak, then we will try and get you on. Marla, can you hear me?
Yes, hi, can you hear me?
Yes, I can. Why don't you go ahead with your comment? Thank you.
Hi, thanks for having this wonderful meeting. It's important for everybody to come together and hear different viewpoints. I'm here courtesy of the Clara Martin Center in Randolph, Vermont, where I receive services. I am an advocate, a professional, and a client, and I work for the Pathways Vermont support line, where I hear people from all over the country talk about an epidemic of loneliness. So I'm really here to emphasize what some people have already said, that, you know, the DAs need more funding. The staff turnover and staff retention is really an issue. The kind of work that I do, what I'm paid, it's something, but it's not even recognizing the real value of the mental health work that I do. I'm actually saving lives sometimes. I hear people talk about suicidal ideation all the time. Each day we get 2 or 3 different calls about suicide. I'm also here to talk about better funding for drug and alcohol treatment. I'm clean and sober, but through the grace of God and the help of the Clara Martin Center and my local AA program. But the other issue that really is resident for me is homelessness. When I was 29 years old, I was homeless and lived at the Safe Haven site in Randolph, Vermont, again through the Clara Martin Center. And even though I work for an agency that provides housing first programs people to veterans and homeless people throughout the state, my boyfriend's son is chronically homeless, and I was told he is quote unquote not homeless enough. So this is a really, really big issue. The homelessness, the mental health, the quality of living, the pay rate. I mean, you know, mental health and physical health and spiritual health are all intertwined and interconnected. And we need, as Vermonters, to look at the most vulnerable populations and raise each other up, help each other, and make people find meaning out of their lives. And, you know, again, I'm here courtesy of CMC, and I thank you very much for listening. There's a lot more I could say, but I don't want to give out any identifying information about callers. So I thank you for letting me speak, and God bless everyone.
Thank you very much. I really appreciate the comments. We've had some really good ones today, and so I think we have another comment. Carol? Carol, can you hear me?
I can. Good afternoon.
Yep, and I can hear you, so go ahead with your comment.
Great. Systematicus. I'm the Executive Director of Senior Solutions. I work out of Springfield, Vermont, and we are the area agency on aging for the southeastern Vermont region. This morning our office administrators met to discuss a challenge that's facing us at the moment. Specifically, we're finding that there's a need for grants for our need for grants for caregivers is exceeding what we had budgeted for this year. And we're finding across the board that the needs for supports for older adults, their families and caregivers is increasing and exceeding our resources and presenting ongoing challenges for us. And we believe it is a time for a significant reinvestment in the services and supports that we provide for older adults. This is based on what we know about demographic trends, as well as what we now realize regarding the social determinants of health and the interconnection between health outcomes and social and human supports. And I see aging services as not about serving a distinct population, but more about what kind of community we want for ourselves, our family members, and our neighbors. Welcoming and supportive communities support positive health outcomes for older adults. They strengthen our state. They help keep our community strong, and they help keep everyone healthy. Caregiver stress is something we're increasingly becoming aware of as a serious concern, that how we serve and support older adults impacts not only their health, but the health and quality of life of caregivers as well. Our funds, many of our funds for our programs are administered through the Department of Disability, Aging, and Independent Living, specifically through grants through the Adult Services Division. In addition to that, we provide services through the Choices for Care program. This program is a community-based alternative for individuals who otherwise meet the clinical criteria to be in a nursing home, and it provides individuals with an alternative to be served in their homes and communities. And these funds are administered through the department, or come through the Department of Vermont Health Access. So again, we're stressing a need to reevaluate how we're supporting older adults in our communities, and again, to make a significant reinvestment and increase in funding for these supports. And finally, I did want to just express a concern that came through our advisory council that met last week, which was they expressed a concern regarding the format of this webinar. And we're concerned that the format would not be accessible to many older adults. In fact, it didn't seem as if there was a way for a person to call in without signing in through a computer first. So I did want to express that. And also the survey didn't provide options for individuals to identify or to choose services or supports for older adults as an option. So I would encourage, if you are continuing to gather input, that you find a way to do that that can be more inclusive of older adults or other people who may be challenged by the technology.
Carol, thank you for your comments. I appreciate particularly those last couple of comments. I think we had received that feedback and we'll certainly take it into account. And in terms of this webinar, we will be reviewing the way it worked and looking at how we can improve it. You know, I would say that, you know, compared with last year, for instance, as I mentioned early on in the call, when we only got, I think, 18 people between the two webinars, we've had much more participation, but it is important, as you suggest, that we get a diversity of participation, so we will be looking at that going forward. So thank you for the comment. Next up, I think we have Steve. Steve, can you hear me?
Oh, yes, I can. Thank you. I just want to make very brief comments because I would rather submit written testimony. Partly because I'm not well prepared today, but I wanted to just mention that there's another part of the puzzle here that I don't think has really been adequately covered, and that's foster care. And I think that we have a real crisis in foster care, that reimbursements for foster parents are getting so inadequate and that people can't afford to do it anymore. None of us do it to make money, but we can't all do it without adequate reimbursement to sort of cover the cost. and the stresses are becoming greater. I know that's true at DCF, and it's certainly true at NFI, which I do work through as a therapeutic foster parent. And I just wanted to say, I hope that that you're open to some close look at the situation, which I think is a real crisis. We've got a lot of kids with huge needs who are terribly underserved, and you certainly can't cut it anymore. Thanks.
Thank you very much. We appreciate the comment. I think we now have Scott Johnson. Hang on, I'm getting ahead of the technical people. Okay, Scott, can you hear me?
I can hear you, Justin. Can you hear me?
I can.
Very good. Thank you for the opportunity. I'm glad that we got the audio thing worked out. My name is Scott Johnson. I'm the Executive Director of the Lamoille Family Center in Morrisville, one of 15 parent-child centers across Vermont, and with you today in my role on the Executive Committee of our network. We deliver a core set of services primarily focused on providing support and education to families with young children. Parent-child centers deliver services ranging from parent education, community playgroups, maternal child health, home visiting, and high-quality child care, to name a few of the services. We are a critical piece of the Vermont social safety net, and in many ways, parent-child centers are the answer to helping support children and families to thrive and avoid costly downstream services. When each parent-child center provides high-need families with the support they need and thus prevents one birth to a teenager, one woman in prison, one child placed in foster care, one single mother receiving public assistance, we collectively save the state $2,100,000. Each of our PCCs does this critical prevention work with multiple families each year, so the savings are significantly more. When the parent-child centers were first awarded state funding in 1988, a base level of funding was provided as a way to ensure that every Vermont community would have access to the services we provide. The base award has essentially been level funded now for 20 years since 1995. Our request is to bring the base funding for each of the 15 parent-child centers to $135,000 and to include an annual COLA so the amount is adjusted yearly. To accomplish this, the total base appropriation requires a one-time adjustment of approximately $1.25 million. We recommend using the parent-child centers to prevent adverse childhood experiences, or ACEs, to achieve better outcomes for families at lower cost overall by addressing adverse childhood experiences that current research shows are social determinants that can lead to disease later in life, and in some cases premature death. Our second request is to support the recommendation in the January 2015 report entitled Integrating ACE-Informed Practice into the Blueprint for Health, and allocate $250,000 of blueprint funds to each of the 15 parent-child centers to provide multi-generational service that prevents ACEs. We also have worked with the Department for Children and Families Family Services over the past 2 years to implement the Strengthening Families Demonstration Project in Rutland, St. Albans, and Barre. Strengthening Families provides intensive family services to families who have open family support cases with the Family Services Division of the Department to keep children safe and families resilient and to prevent kids from going deeper into the custody system. Our request is to bring the Strengthening Families program to every AHS district to the parent-child centers at a total request of $2.25 million. We realize the complexity of the budget that we all face going into FY17 and hope that we'll all have an opportunity to look closely and carefully at the investments that we think will make the most impact for Vermonters. Thank you very much for the opportunity.
Thank you for the comments. I appreciate it. I think next up we have Sally. Sally, can you hear me?
Yes, I can. Thank you.
And I can hear you, so go ahead with your comments.
Thank you. My name is Sally Borden. I'm the Executive Director of KidSafe Collaborative, and I'm also the co-chair of the Vermont Citizens Advisory Board to DCF Family Services. Thank you for this opportunity. As VCAB conducted a comprehensive review last year of the deaths of 2 young children who had previously been in DCF custody, it became painfully clear to our committee that Family Services is woefully underfunded for the work that we require of that system, and sometimes with tragic results. And more recently, the tragic murder of a DCF Family Services social worker underscores the need to provide adequate funding and support so that social workers can have manageable caseloads in order to do their work effectively and to build the important relationships with those that they are serving and to provide intervention to help support families and keep children safe. The social workers at DCF Family Services are charged with working to ensure the safety of our state's most vulnerable children, those who are at risk of or have been abused and neglected. And yet they have excessively high caseloads. They are by and large dedicated professionals who are doing their best with the resources they have, and they're charged with an overwhelming responsibility with insufficient support. And as a result, due to the very challenging nature of their work and the tremendous demands on their time, these social workers can't provide the level of service needed for every child and family to effect the change and to adequately assess and assure child safety. In 2008, the Vermont legislature instructed DCF to achieve an average social worker caseload consistent with national standards and best practices, 1 worker per 12 families. We're not there yet, and now caseloads are burgeoning, largely due to parental opiate abuse. Large numbers of children, especially very young children, are coming into state custody. This speaks to the need, which you've heard about today, to adequately fund substance abuse and mental health services, community-based services, as well as to fully fund DCF Family Services. As we look at our budget priorities, I can't think of a more important priority than making sure that our state's most vulnerable children are safe. Thank you.
Thank you very much for the comments. Alice, can you hear me?
Yes, and can you hear me?
Yes, I can. So go ahead with your comment.
Obviously, the needs in the state are great, if not overwhelming. And I believe that the governor is supposed to come forth with a current services budget. I think it would be astonishing to actually see exactly what the financial needs of the state really are if all of the requests for services and adequate salaries were actually being able to be funded. Thank you very much.
Thank you. I guess I would say at this point that we've also received a number of letters and emails related to current services budget, and so I just want to say that we've certainly seen those. We've had some other folks come in and speak to us about it, and we do intend to put together a more robust current services budget than we have in the past that will go into the budget documents. So that's just so folks know that we are planning to do that. I think next up we have Faye. Faye, are you able to unmute your phone? Okay, so I think at this point we're going to wrap things up. We did put up a slide. First of all, as it says, thank you for your participation. We really do appreciate all of the folks who both joined to listen and also made comments. I think, you know, as I said at the outset, the comments are important to us, and I think they're an important part of the process going forward. As you can see from the slide, that we've got the web address for the presentation, and you can also send information to me, the Secretary of Administration. It's got our address there if you want to send a hard copy. And we also have, you'll see at the bottom of the page, the survey that we're looking to fill out, have folks fill out, recognizing that it does not have the piece on there to identify as an elderly Vermonter, but that's something we will address going forward. But we would encourage folks who haven't to fill out the survey and to also send any written comments or additional information they'd like to send in. And with that, I want to thank everyone for taking the time out of your day in a holiday week to join us. And it's a little early in the week, I know, but I'll wish everybody a happy Thanksgiving. And we'll obviously you'll hear a lot more from us as we go forward over the next 8 weeks or so on the budget. So thank you.